Welcome to upper extremity pain. So objectives of this class, we're going to focus on non-traumatic injuries. So injuries that kind of come on over time. You may not know exactly how they started, but maybe they've been more recent or more chronic, but injuries that didn't have like a trauma associated with those, okay? And then we're going to also take a deep dive into some really common conditions that I see in the clinic and try to figure out exactly the root cause of these issues. I think the best way to prevent these from happening is to understand what's causing them, exactly what's causing them, not just solutions to make them better, but figuring out the driver. And so we're going to try to identify those. And then we're going to go through preventative measures and discuss some ways that I would approach these conditions with patients in the clinic and how you guys might work to prevent these before they happen or reverse them once they've happened. And I don't know if you guys can see my video. I'm sharing this a slightly different way, so I can't see my video, but there may be times where we flip back and forth between the lecture and my video. So maybe just comment in the chat box if you guys can see my video or not. I think you guys can only see the PowerPoint though. If you guys don't mind just saying yes, if you can also see my video, or yes video, or no, I can only see the PowerPoint. That would be helpful just because my computer is kind of glitching out. I'm trying to do this a slightly different way. So if you guys don't mind just doing that real fast, that would be helpful. And then I'll check that. Okay. You can only see the notes. Okay, perfect. That's fine. I know you guys see my video now. I'm just gonna be flipping back and forth because my internet, I think, is glitching out a bit. So I'm just gonna have to flip back and forth, but it'll be fine. So I'm gonna go back and share my screen. Okay. Thanks for you guys' patience. So I just, I picked out some common upper extremity injuries that I see in the clinic. And I know this isn't all encompassing, but I think these will be most helpful for the broadest range of people in this class. And we will go over concepts that will overlap to other conditions as well. And if you guys do have specific questions about anything that you are going through, always feel free to reach out to me directly. I would love to chat with you. But we're going to be looking at two conditions that I see in the forearm and the hand, and then also two that are closer towards the shoulder. So tendonitis, really common thing, commonly in the forearm, also in the hand. Radicular pain can be anywhere from the neck to the hand, and then rotator cuff strain and frozen shoulder, obviously in the shoulder. So first, let's start more distally with forearm tendonitis. So inflammation or irritation of the connection point between the muscle and the bone, also known as the tendon, that it's commonly attributed to an overuse. So people think that it's commonly thought that because you're doing a certain repetitive motion, and that might be part of your job, whether it's working at a computer or using tools, that the muscles are kind of overworking, and that's causing inflammation.
No, that's
sorry, I'm getting a little background noise. I thought I muted that, but I'm just gonna do that real fast. Hang on a second, mute all. There we go. That should fix it. And then I'm just gonna share again. There we go. Okay. Perfect. All right. So common tendonitis conditions: tennis elbow, golfer's elbow, de Quervain's, tendinosynovitis, carpal tunnel, swimmer's shoulder, tendonitis of the wrist. Common things that we see in the clinic. So what's the root cause of these issues? I'm going to try to really simplify this down, and it's not going to be specific towards every single presentation, but I want to try to just figure out big picture what likely causes these things. So I want to work backwards. So what do we start with? You have pain in or around the forearm, anywhere from the forearm to the hand. Usually with tendonitis, we're seeing that right around the elbow, whether it's on the front of the elbow, the back of the elbow. It's stemming from irritation of those forearm muscles. Why is there irritation? Why are the nerves getting irritated? It's because of inflammation and swelling, and there can be micro trauma in that area as well. And what causes this inflammation? It usually is a repetitive task, such as typing, mousing, using tools, texting or scrolling on your phone, writing, even sleeping, which we don't think of as a repetitive task, but something you're doing for a long period of time. And also swimming or throwing could be a variety of different things other than what I've listed as well. But we think of these things as like overuse because we're doing these repetitive tasks. But what I want to really point out to you guys is that it's not just overuse, but overuse in a suboptimal position. So the body is designed to do these things. We should be able to type or throw for long periods of time without any tendonitis, right? But we're often working in positions that using the body in ways that it wasn't set up to do optimally. And so poor posture, poor body mechanics. And this comes down to a combination of two things that I commonly see, and that's physical conditioning, lack of physical conditioning, and lack of awareness. So the person might not have the ability to use the body in an optimal position. So they're let's say like they're working in a position where it's putting excessive stress on that tendon. That's kind of what we're saying by that. Or let's say they don't have the endurance to maintain a good position while they're working. If they get fatigued, and then that causes micro trauma, or maybe they don't have the coordination, or maybe they don't have the flexibility in the first place to even get into a good position. The other part of that is awareness. I think a lot of people don't understand like correct positions to do things in, right? To where should the arm be when I'm writing, for example? What position should my wrist be in? Where should my neck be? I mean, the neck could be out of position, the shoulder, anywhere down to even looking at the pelvis. The body all works together. And so optimal posture is going to be your best bet for avoiding tendonitis, no matter what activity you're doing. Let's look at radicular pain. So this could be compression on a nerve, and it could be anywhere from the neck to the hand. We see it everywhere from the neck to the hand. So radicular pain is electric-like shooting pain that you feel down the arm, but the problem could be higher up. It becomes a radiculopathy when neurological symptoms start taking place, so that there may be numbness or change in sensation, or even a weakness in more progressed cases. There also may be a change in reflexes, and this can be present on top of pain. All these things can be present on top of pain. So if you guys if someone has like numbness, if you notice any numbness down your arm, that's kind of, that would classify in my mind as maybe radicular pain starting to become radiculopathy, but it just depends. There's some overlap, but that's basically what we're talking about with radicular pain. What's the root cause of that? the nerve is getting compressed. And again, that could be anywhere from the neck all the way to the hand. And why is that? The body, again, is likely operating in a position that's putting compression on that nerve somehow. And that can be through mechanical restriction. So maybe there's a tissue limitation, tightness, lack of mobility. And then it could be over time that this has developed. Maybe you say, like, I've been working at a desk for 20 years. I never had this happen. Now all of a sudden I feel numbness in my hands. Well, the body can over time withstand a lot until you start to see symptoms. But what happens is if you use a suboptimal posture for over a long period of time, your body will kind of mold this position. So a good quote that I heard is the body is cement waiting to harden. And the positions that you habitually work in are positions that your body is going to have a hard time getting out of unless you're intentionally stretching and working muscles in ways that kind of allow for variability. You don't want to ever, you see a lot of people kind of get stuck in like a kyphosis or rounded upper back position or like a forward head position. And this is because their body has really adapted into that through years of training themselves to do that. And so that's something I want to really call to light in this class is, do you have any postural habits, whether that be through sleep or sitting or standing or a variety of different tasks that you're doing throughout the day, that you're using your body in a way that's putting increased pressure on your shoulder, your arm, your elbow, your hand, because these are all things that we can correct and actually make symptoms completely better, if not gone, without doing anything like an injection or surgery, nothing invasive. I mean, these are things that they're very simple to correct if we draw our awareness to them and really understand what causes them. And again, you'll notice a common theme, physical conditioning and awareness. Your body's ability to work in an optimal position, and then your awareness of what that is. So just a word here on avoiding overuse injuries. Be aware of body mechanics. So I'll just skip ahead to the second point for a second. Using supports, we'll get into what that looks like with sitting or sleeping. But understanding how you can support your body in say sitting, for example, using maybe lumbar support or like a towel roll, or adjusting your seat or adjusting your desk, having a standing desk, making your environment work to suit your needs instead of becoming a victim of your environment. Usually when someone has an overuse injury, such as like a tendonitis, there is a cause, and we can always modify that and make it better. You're never just stuck in your symptoms. We can always make it better. And so if you guys have that going on, you don't know why, just know, and we'll get more into it, but there is a cause, and it can be better. So I want to talk about the concept of neutral to kind of illustrate how the body works better in like a more neutral position. So I'm going to switch my screen here. Oops, hang on one second. So, okay, hang on. Switch back to this. Stop share. Okay, so now you guys should be able to see my video. Okay. Okay, you guys can all see my video. All right, so I want everyone to make a fist, and then we're going to flex your wrist down, and then resist yourself with your opposite hand, and just match the resistance. So like if you're using your right, if the right hand's making a fist, match your resistance with the right wrist to the left hand, and use a lot of force, but don't let your wrist move at all. And just notice how that feels through through the front of your forearm. And then you guys can hold for a few seconds longer. Don't do this if you have pain. If any of this causes pain, stop. So this time, let's have the wrist straight and then push from that angle. And again, no movement. And let's just hold that for 10 seconds or so. And then let's move the wrist up, so extended. And same thing, resist yourself and hold that. And the longer you go, the more you can notice this. So if you want to keep going as I talk, but I want you guys just to notice the difference between how your muscles are working and what you feel in those three different positions, and then ask yourself which one is best. You might notice that you feel a strain in one or more of the positions. I felt it a lot when my wrist was flexed, but the idea that I'm trying to get across is neutral. So the wrist being straight like this is the most ideal position to perform an activity in, to resist yourself in. So if I'm typing, if I'm using my muscles to type, I would want to keep my wrist neutral. I wouldn't want to be extended. I wouldn't want to be flexed for any length of time. If I do, then I'm forcing. Depending on how my wrist is, if it's extended or flexed, I am forcing that side of my arm to work in a suboptimal position. And if I do years of that, then that can lead to like a carpal tunnel or an extensor, like a de Quervain's, or something that's going to really be debilitating. And if you don't know exactly what's causing it, you're going to keep doing it. So awareness is huge, but also like the physical conditioning to use your body neutral. Some people, and you don't see it as much with the wrist, but in the shoulder, maybe the shoulder is in a position that they can't even get into neutral. So physical conditioning is huge as well. So I'm going to go back. Let's go back to my screen. Okay, back to the PowerPoint. Okay. So using supports, concept of neutral. Also, you guys should ask yourselves if you're, no matter what you're doing, let's say you're working at a desk, ask yourself as time goes by, are you experiencing any pain anywhere in your body? Is it like you have pain in your hands, your forearms, your shoulders, your back? Are you feeling any fatigue? Do you feel any stiffness? Do you feel like you need to shift? Listen to those little signs in your body, because those are clues that your body is telling you you need to move, or you need to modify something that you're doing, or else you're going to cause inflammation. You're going to cause an issue. Let's say you don't exactly, you might feel like stiff when you're sitting all the time. So you need to be asking the question, why is sitting causing me to feel stiff? Because sitting shouldn't make you feel stiff. If you're sitting in a good posture, you should be able to maintain that posture, that position for at least an hour or two without feeling any kind of pain or stiffness. Or let's say you're waking up with shoulder pain. Ask yourself why. How is my sleep position contributing to that? And there are resources that we can pass on to you guys. If you can make it into the clinic, it's obviously easier, or when we get back to in-person classes, that's easier. But given that this is over Zoom, you guys are going to have to self-diagnose a little bit more. And just ask yourself, is my sitting maybe contributing? Is my sleep contributing? Is something that I'm doing contributing? Because there is a way that we can fix that. And then just being intentional about your rest. If you are let's say you are working on a computer all week, try to take a day or two off on the weekends. I know in physical therapy, we're pushing a lot with our hands, we're pulling. It's quite physical on the hands, on the forearms. So I'm taking like a day or two each weekend to not treat people and using that time to recover so that I can be at my best to treat my patients during the week. And then also like knowing, let's say you do use your hands a lot, you're doing manual labor. What can you do, whether that's soft tissue work, or even maybe you're going to get a massage, or you're getting treatment of some sort, or you're working on specifically strengthening or making more mobile different parts of your body that can then support what you're trying to do. I don't know if that made sense, but trying to be the fittest version of yourself to support what you have to do every week. And if you're having pain with your activities, then something needs to be modified, or you may need to work on either your strength, your flexibility, neuromuscular control, but all things that we can improve. So let's move on to the shoulder. Common thing that we see in the shoulder is rotator cuff strain or tear. So working backwards again, if you're having chronic pain, like reaching overhead, like maybe lifting a weight, or let's say you just have pain when you lie on that shoulder. In progressed cases, there may be irritation or like a weakening or a tearing in the rotator cuff, which is leading to that pain. And just to make this as simple as I possibly can, I think this is stemming from the rotator cuff working or being forced to work in a position that is putting increased friction on it over time. So again, this goes back to how are you using that rotator cuff? There's ways that you can use it and you can do tons of repetitive tasks and never have pain because you're using it in a correct neutral position. But let's say you're back to the sitting example, you're always sitting, your body is kind of molded into a kyphotic forward head, internally rotated shoulder position. I'll show you guys kind of what that looks like in the next slide. But let's say you're working in that position, and then every time you reach overhead, the rotator cuff is kind of getting that micro, like a tearing, right? Like a little irritation or friction. And then over time, that's going to cause an issue, right? The body can heal and adapt if it's just a short period of time. But if you're doing that every day, we have to break that cycle somehow for that condition to reverse. And again, this stems from a combination of mechanical dysfunction and poor neuromuscular control. So different tightnesses, different tissue restrictions can develop in and around the shoulder, and then the muscles, how they fire, and how you kind of use those muscles is going to change, and that's just going to kind of feed into that issue. So really common dysfunctions that we see associated with issues in the rotator cuff: poor internal rotation, or I'm sorry, excessive internal rotation of the shoulder, like you can see in this guy in the picture. And then with that, the shoulder is going to the posterior shoulder muscles, so more towards his back, are going to be in an overstretched position that makes it very difficult to find posterior depression, which is basically just the most stable position that we can have the scapula in. But the scapula is going to be more forward and out of that. It commonly is with rotator cuff issues. And then there's going to be a thoracic kyphosis, or a curving of his upper back, along with a forward head position. You can notice how his neck is just slightly forward. And then weak rotator cuff, which makes it more susceptible to a tear or to any kind of irritation. There's going to be tightness, the front of the chest and the pectoral muscles, and along the sides underneath the arms in through the armpit area, the latissimus muscles, and then poor joint mobility of the anterior rib cage, because he's just so forward, difficult to kind of open up that whole front of his body. So you guys may have one or more of these things going on. I know I have multiple of these going on. These are very common. And that's why it's so important to maintain good posture, because we already have this like naturally going on, because it's just the kind of world that we live in. We have to do a lot of work in sitting. We have to do a lot in front of our bodies. Most of us have thoracic kyphosis. Most of us have tight pectorals. But we're going to get into what we can do a little bit later to work through this, to prevent this from becoming symptomatic. And these are things that are worth addressing before symptoms occur. So just a word on frozen shoulder adhesive capsulitis. This is very common. And this is one of the most frustrating conditions, I think, because it's just so slow to resolve. It can take a year, 2 years, and the patient cannot easily move their arm overhead because of pain, or even reach behind their back because of pain. And it's just, some people can't even use their arm, any movement. It's just so sensitive. And so in my experience, a big driver of this is just failure to move your shoulder through its full range of motion every day. Meaning like overhead, behind your back, reaching out to the side, going through a throwing motion, different rotations of the shoulder. And it helps to even load the shoulder in different ways, working different muscles, stretching, weightlifting. All these things can be helpful, just providing different input to your shoulder so it doesn't get stuck in one position. Someone might be predisposed to a frozen shoulder by not moving through the full range every day. Let's say some people go days or even weeks or months without even reaching over their head. That can predispose you to this. But usually frozen shoulder will be triggered by a trauma. So you might be set up for it, and then you have a trauma, maybe you have a fall or impact through the shoulder, and then you are already set up for adhesive capsulitis to develop, and it's just gonna kind of go down that road if you're not already, like, if your body is not already in good physical condition. That's why it's so important to treat these things before they develop, because once this starts, it kind of sets off an inflammatory cascade where it could take a year or two to get better. And I think we can make a huge positive change in this through physical therapy. But I'd rather not have to work from behind the 8 ball. I'd rather take care of it before it develops into a full-blown adhesive capsulitis. So I said this quote before, but I just want this to be kind of an emphasis point. The body is like cement waiting to harden, use it or lose it. We have to move. We have to continue fighting for full range of motion, whether that is elbow, getting full flexion, full extension, wrist, shoulder. We're going to go through some stretches, some exercises at the end of this class. If you notice that it is kind of hard to reach up over my head, it's hard to reach behind my back. These are things that definitely are worth addressing before they become painful conditions. So ability, yeah. So basically what I just said, perform a variety of motions with your shoulder. each day. So let's look at how the neck can contribute to upper extremity pain. I want you guys to notice in this picture just how the nerves are exiting out from the cervical spine. You can see I drew the arrows, and then coming down through the armpit, underneath the arm, going on either sides of the elbow, down the forearm, all the way down to the hand. And just imagine how any motion of the neck, whether we're tilting the head to the side, looking down, forward head position, even like the back, rounding of the upper back, internally rotated shoulder, how that can contribute to pressure in and around those nerves. So just kind of appreciating that the body is all connected, and head and neck posture is very important if you have numbness, tingling in your hand or your forearm, or you're having a tendonitis. That can stem from the neck, that can stem from the pelvis being out of position. So that's slouching your low back, and that's causing a kyphosis in the thoracic spine, which is pushing the neck into forward head posture. And it can get a little bit complex to self-diagnose. And so if you do think that, hey, this posture thing is something that I need to be more aware of, we have other classes that we've talked about that. If that's you, shoot me an email at the end of this. I can send you resources on sitting posture, standing posture. We can work on that. But for now, sorry, I'm getting a little bit of feedback. Do you guys mind? I thought I muted everyone. Do you mind just making sure you guys are all muted yourselves? I can try to look at that one more time. Thank you guys. Appreciate that. I don't know. Mute all. For some reason, it just keeps unmuting. Okay, that should be good. So let's talk about neural tension, because neural tension can cause, it's going to be basically, it's going to be like a stretching, pulling sensation. It's going to be stemming from pressure around those nerves coming from the neck down the arm. And it's basically those nerves sliding between the tunnels of the muscles and the fascia, the bones, and not being able to do that smoothly. So that there may be tension or compression in different areas that's leading to those symptoms. So again, neural tension is like a burning sensation. Maybe you feel like an overstretch when you move your neck certain ways. Maybe you feel it down the arm. It could be a numbness, tingling sensation, and stemming from pressure along that course of the nerve somewhere. But I wanted to look at some very common areas that we treat in the clinic, from the neck down the arm. So first, immediately when the nerves exit the cervical spine, the spinal cord, and come out, they're going to go through the scalene muscles. So these are going to be right along the side of your neck. I'm going to switch my screen real fast to see if I can show you guys what I'm talking about. Stop. Okay. So I'm looking right along the side of my neck here. If you can't exactly see where I'm pressing, oops. Okay. Everybody good? Can you guys all see me? If you guys can't see where I'm pressing, just do a quick sniff, and then those muscles are going to bulge out as you do that. So those are the scalenes, and the nerve bundle is going to run right between the anterior and the middle scalene, which I will show you guys, and you can kind of work in and around your neck as I'm talking, which I will show you guys right now. So back to my picture. So this, these are C5, C6, C7 going in between the scalene muscles here. And those are very important muscles that we work on to take compression off those nerves. They're commonly in spasm, and we can relieve that through soft tissue work, but also that's going to be a short-term fix if we don't modify usually a posture, a sleep position or sitting posture that the person is habituating that's playing into that. And so you can see that also in this picture, how the nerves come right between those muscles and then go under the pec minor. And that's something else, another muscle that commonly is in spasm and putting pressure on the nerves. And so we work on both these muscles to relieve that nerve tension. And then also the biceps tendon. So as we get further down the arm, you can see I circled it in blue. You can see that thick band that the yellow nerves are going right under. And even along the medial aspect of the arm, those muscle tension in that area can be pressing on those nerves and causing that tension as well. And you may feel these symptoms in your hand, but it's important to realize that they can be coming from higher up as well. And that's where we work to kind of trace and isolate and then hopefully relax that tension. So then working further down past the biceps tendon, getting into the pronator teres, which you can see in the picture on the left. You can see how the nerve goes right under that muscle as well, and then down in through the forearm. And this is where I'm particularly drawn because people have their symptoms here, and I always like to start by kind of touching the area that's having the most pain. And so you can see where I circled, and just what I want you guys to appreciate is just how all these muscles kind of intertwine and run along the same course, but they are individual strands of muscle. You can see flexor carpi radialis, brachialis, flexor carpi ulnaris, palmaris longus. All these muscles are just in close proximity. And what happens that we commonly see leads to those symptoms down the arm is that instead of being able to slide and glide on each other or dissociate from each other, they get very clumped together and just very stiff, which makes it very difficult for the nerve to slide through those little passageways. And when the nerve is getting pressure on it, it's going to be irritated, it's going to be inflamed, it's going to cause that tingling or that shooting sensation that is commonly felt. And then muscles of the palm can be involved, the transverse carpal ligament can be involved. We work around the thenar and hyperthenar eminences, basically just both sides of the palm. And you can see the nerves are red here, but you can see how the median and the ulnar nerve pass right under that ligament. And you can see how tightness in those muscles can affect how that nerve is moving. And even if you guys go back to the past example that we did with your fist resisting yourself, and maybe you do that again right now, or just move your wrist forward and back and just notice how that's putting more or less pressure into that area versus having your wrist straight. And it is really easy to notice this with the example of resisting yourself, but maybe more subtle is this is probably happening when you're typing or mousing or texting or reading, writing, and that's where it becomes tricky to identify. But these are things that are very real causes of the symptoms. So self-treatment, I I'll talk about soft tissue mobility first. You can see me working on my own forearm in the bottom picture. And I'm basically just running my thumb right down the seams of those muscles. So if you look back at this picture and notice how those muscles are like guitar strings, you can really go in between them, and you don't need to know exactly where they are, but just starting at your elbow, maybe you go to the front of your arm and you just run your thumb down along that line. So I'll show you guys in a second what I'm talking about with the video, but running all the way down, putting some, like a good amount of pressure. You can even find a spot that's particularly tight and move your wrist to loosen that up. And then neural glides as well. I'm going to show you guys both of these things at the same time on my video. So 1 second. Okay. All right. So I'm going to back up my computer. Okay. Can you guys all see me okay? Yes, okay, perfect. So I'm gonna show you I'll show you this side. Just starting at the elbow and kind of running my thumb down the seams of those muscles. And this is one of my favorite things to free up nerve tension in through the forearm. You may notice that this immediately relieves symptoms. And then I'll find a spot usually, and then just kind of move my wrist as I'm pushing down. And this is a good opportunity to be aware of how you're using your right hand. So not excessively flexed, not excessively extended. Also thumb position, right? I don't want my thumb in like a hitchhiker's position. I want to be actually biased more towards flexion, because that's going to protect the joints. And be aware of this joint particularly, especially if you're not used to like doing any kind of massage on people. But kind of working down through those muscles, moving the wrist. You can even try kind of like a circumferential motion. So I'm kind of turning the muscles around my forearm, so holding there, and then I create tension. I hold that, and then just moving the wrist. And I can do that in different positions, so different places along the forearm. And I can go both directions too. So I can twist this way, I can twist this way, I can work down the seams, I can work on the other side of the forearm, working down the seams. And then something else you can do is just having your wrist in, so this position, and then working down again as I'm moving, or even going the other way. Careful not to put your full body weight on it if the back of your hand is down. All different ways to kind of relieve those symptoms into the arm. And then neural glides. So I'll try to show you guys a few. The median nerve. So it's going to be, if you can tilt your hand down like this, and then move your arm out to the side, and then move your head the opposite side, and kind of try to turn and look over your opposite shoulder as you move the wrist down. And be careful with this, go slow. You may feel a pulling, nervy sensation. You may feel a numbness or like a tingling if you stay in it too long. But basically going right to the doorstep of those symptoms. And then you can either move the wrist, you can move the neck, you can move the neck and the wrist. You can kind of floss in and out of that tingling. But you don't want to stay in that for too long. It's kind of like an active motion where you want to go go through it, but not experience the symptoms for a long time. So that's the median nerve. The ulnar nerve, if you make an OK sign, turn it upside down. You can try to put it on the side of your head. You can bend your fingers. So I have an OK sign. I'm turning it upside down. I can take my pinky and ring finger and bend them back, and I can feel a stretch there and kind of move again, it's an active motion. I can go like this. I can move my arm out to the side. Lots of different options. If you don't have any neural tension, you're not going to feel it with this stretch. If you do, this is probably lighting you up. But that's ulnar nerve. And then radial nerve, you can make a fist, point it downward. Make a fist, point it downward and kind of towards your pinky. And then your arm's going to come down and kind of rotate inward as you're reaching down and behind your back. And then you can move your neck to the side, and that's going to increase the sensation. So that's radial nerve. So like a combination of nerve glides and soft tissue work as kind of like a first treatment strategy to reverse neural tension and radicular symptoms. Okay, let's share my screen again. Okay. So, I was going to make just other common triggers that can cause neural tension. Sitting posture, phone use, sleep position. We're going to get into that in the coming slides. I just got to get through these last 7 or so slides. I may be running 5 minutes long, but thank you guys for hanging with me so far. Sleep position. So I see a lot of issues in people that lie on their side in the side that they're lying on usually. And it's usually due to them not supporting the neck well. So focus on the picture to the right. You can see how that pillow is pulled really close to the base of the neck. It's not under the shoulder. Common mistake is that people put their shoulder on top of the pillow. And what that does is it creates a space at kind of like the base of the neck. And that's not being supported at all. So that tension is going into the muscles of the neck. And so the scalenes, the upper traps are holding tension all night, which is leading to, can lead to symptoms down the arm. It can also like shoulder. Let's say the shoulder's on top of the pillow. It can lead to an elevation of the first rib, which can then be causing issues with pain in your arm. It can be causing headaches. So a lot can go wrong being a side sleeper. I sleep on my side, but it's just really important to be cognizant of correct mechanics when you're doing that. Being a side sleeper, you want to shoot for a softer bed so your downward shoulder can kind of sink in a little bit more. If you're a back sleeper, you can get away with having a firmer bed. You want a firmer bed actually, but regardless of being a side or back sleeper, supporting with pillows is really important. And if you think sleeping may be a contributor, let's say you're waking up with symptoms, or you wake up with stiff neck or stiff shoulder, and reach out to me via email. And we can send you a blog we wrote on sleep position. And we talk about that in some of our other classes too. So just support is huge. And sitting posture, big driver. This is actually a suboptimal position. You can see how his pelvis is kind of rounded back. That's causing a rounding through his upper back and promoting a forward head position, which we talked about how neck position and motion is closely tied into symptoms down the arm. Also, if he's going to be typing or mousing for any length of time, he's going to be putting increased pressure on the muscles of the forearm that could lead to a tendonitis. So it's not just his wrist that we need to be aware of, it's the shoulder, it's the neck, it's the pelvis. And so being really aware of sitting posture is huge. I did put a link in here to a guide to optimal sitting. It's not going to show up on the PowerPoint we emailed out to you, but definitely reach out to us and we can send you that if you're working for any length of time in sitting or on a computer. So let's just get into some self-maintenance rehab strategies to not only reverse, but also prevent these issues from happening. So we talked about wrist mobility. I showed you guys that stretch. I would definitely do that if I was doing, well, I do this exercise myself, but I would recommend you guys do it if you're working with your hands, if you're working a desk job, computer work. I would be doing this just to maintain the ability to keep doing that. You can do like a self mobilization of muscles of the palm, using I use my thumb like I'm showing in the picture, and then just the importance of working in neutral, like you can see here. I might be in a little bit of extension here, but I'm trying to be aware of keeping my wrists as straight as possible, not too flexed or extended. So maintaining health of the neck, which we talked about, closely tied into shoulder, arm, wrist, cell phone use. So shout out to Kara, our new office administrator. So you can see from how she's using her phone, very common to use your phone this way. Not a good thing if you want to have good health of your neck and avoid upper extremity tingling or shoulder pain. You want to hold your phone or use an earpiece. Computer use. This is Pete in a lot better posture than the previous picture. You can see how his pelvis is in a more neutral position compared to a few slides ago where he was quite rounded, and you can see how that plays in up the chain. And then here, how it's a lot straighter. He's using 1 foot back to kind of anchor his pelvis, and then sitting more onto his pelvic floor. The neck's in a much better position. And then ideally supporting the elbows then on the desk or the arms of the chair so that the elbow can be at 90 degrees. Second. Sorry. Okay. All right. So, oops. Sorry, hang on. Hang on 1 second, I'm gonna get my screen back. Oops, sorry, jumping ahead. Okay, so texting mechanics. First picture, not so good. I'm looking down, you see a lot of people text like this. So next 2 pictures, a lot better. I wanna hold my head up in a neutral position. I'm using, in the second picture, I'm using my arm, my right arm to support the left. And then a third picture, I have both my arms up. So that's gonna be a lot healthier for your neck over time than looking down. And if you're, let's say you're sitting on a couch, just be aware of how the upper back can tend to round, the neck can tend to flex, and that can put pressure on those nerves coming out of the neck. Scaling, mobilization, these are just some self-mobilization activities for the neck. Scalenes we talked about. So I'm putting those 2 fingers there, the picture to the far left. And then I can move my neck in different ways that I feel stretches through that area as I'm doing kind of like a self massage. And then thoracic mobilization is huge. This is something that we get people started with on day one, just because that thoracic position, it has so much influence on the shoulder, on the neck, and how we're using our hands, how we're typing. So whether you're using a foam roll or two lacrosse balls or tennis balls, we usually put like a couple of tennis balls in a sock and give that to people to take home. And that can be very specific at mobilizing the spine and getting better extension. And then if you guys have any questions, I'm kind of breezing through these. Sorry, I'm going a little long, but I can send you any of these exercises that you have specific questions about. Self-mobilization for the upper traps, similar to the scalenes, just kind of putting pressure there, moving the neck. And then axial elongation is something that we use to train kind of the core of the neck, so to speak, in a neutral position through self-resistance. Shoulders. I love prone, eyes wide and T's over a ball, or even lying flat on your stomach with support, just for scapular stability and training the rhomboids and the upper, middle, and lower trap muscles. The back, like we said, can get overstretched and weak when we're doing like a lot of sitting. But commonly we just, even people that aren't sitting a lot, we do so much in front of our body that these muscles are just weak and they're more susceptible, or they make the rotator cuff more susceptible to injury. They make the neck more susceptible to injury if they are weak. And so just having good scap stability is huge. Rotator cuff, external rotation with a band, and then unilateral rows to the far right. I'm just pulling that band straight back. So really important to maintain strength in and around the shoulder. And then mobility for the shoulder. I give this to a lot of people, doorway pec stretch, just kind of pulling through I'm reaching under my, kind of like into my armpit area and pulling the muscle forward. At the same time, I'm rotating the opposite direction. So stretching the pec as I'm doing some soft tissue mobilization. And then the lats can be stretched either of these ways with one arm or two, but feeling that pull down through the sides of my body. And an AC joint mobilization, if you just trace your clavicle out to where it connects into the posterior bone of the shoulder or the acromion. It's a little bit hard to direct you guys to that, but all the way out the end of the clavicle, you'll feel that connection, and then pulling the clavicle forward as you shrug the shoulder or move the arm. That can be an area that gets just very stuck and plays a big role in this as well. And again, I know I breezed through these. Reach out to me for specifics, or I'd love to hear from you guys after this class. If you're going through anything that I might be able to help in greater detail, we can get on a call. I can direct you to our blog on sleep. We've done videos on posture, so would love to continue the conversation after this. So thank you guys for joining tonight. I hope that was helpful. If you didn't get this PowerPoint sent out to you, you can reach out. We'll send it. We can send you any of those links. If you don't follow us already, we're always posting. We do a lot more posts on social media than classes. So you might, if you have like different issues like back pain or knee pain, we have a lot of those posts as well that can help. If you know someone that would benefit, definitely direct them. So emails, you can shoot us an email, oc@ipa.physio, or here's my personal email. If you have more questions, I'm just gonna flip my screen back. And then the next class is going to be November 10th. That will be that'll be with Kat. We don't know. I don't know. That's to be determined. But you guys aren't going to want to miss that. It's going to be awesome. It's going to be 7 o'clock, I believe, on a Wednesday night, or maybe a Thursday night. That's going to be here as well. So thank you guys for joining. If anyone has any questions, I'll stick around for a bit. I know I said I was going to check the chat box. You guys can type in any questions right now. I'll stick around for a few more minutes, but thank you guys. Okay. Roberta says the down arm can be propped into the princess pillow to put it in neutral to avoid sleeping on the hand. Definitely. I'm big on positioning using pillows. If you guys are having issues with sleep, waking up with pain, definitely reach out. We can change that. Yeah, thank you guys. If there's no other questions, I'll close it down. All right. Have a great night, guys. Thanks for joining.